a new multidimensional neurotherapeutic method for healing of trauma. Psychological trauma leaves a lasting imprint on various levels of an individual's self. The self is formed from a bottom-up approach, integrating somatic experiences into emotions and then into cognitive experiences. Traumatic events can disrupt the integrity of the whole self-experience across all these levels. At the autonomic nervous system level, trauma impacts the flexibility and adaptability of the system, potentially causing it to become stuck in the extremes of the autonomic spectrum or trapped in automatic responses without adaptability. This leads to familiar maladaptive responses to stressful situations. When a patient consistently reacts with similar response patterns despite having insight into their emotional patterns, it is indicative of a fixated autonomic repertoire, which generates negative emotional tones and thoughts, ultimately cascading into a negative ego. Traditional therapeutic approaches often focus on one tier, such as biofeedback therapy for autonomic responses, psychotherapy for cognitive schemas, or psychiatric medication for neurochemical intervention. However, a comprehensive approach addressing all tiers under the supervision of a professional familiar with the multi-level system is vital. The proposed method relies on cultivating specific neurophysiological states and focused meditation. The process involves a step-by-step implementation. Prepare the client with breathing techniques, including alternate nostril breathing and slow rhythmic breathing, which are used in HRV training. Teach the client to enter a no-thought zone, a form of meditation that moves attention away from thought cascades. Educate the client on the default mode network, DMN, how trauma perpetuates recurrent ego states, and the importance of moving attention away from DMN to control the process. The client should understand the following. Number 1, autonomic relay and its role in perpetuating trauma. Number 2, the role of breath training in creating a balanced autonomic state. Number 3, how DMN perpetuates repetitive, self-destructive perspectives and patterns. After cultivating attention, guide the client through revisiting traumatic memories. Instruct the client to pay attention to their body's reactions and arising emotions. Then, have the client willfully move their attention away from thoughts and into the void, deliberately shutting off the DMN and entering the executive network. Encourage the client to breathe at a rate of 5 to 6 cycles per minute during this process. This is a critical moment when maximum transformation occurs in the neurophysiological space. Instruct the client to transition back and forth between the voided state and the trauma-related state, repeating these inner transitions several times. After completing the active part of the session, have the client continue breathing at 5 to 6 cycles per minute without engaging in verbal interaction about the memories. Instead, encourage them to feel the emotional states within their body. These sessions can be repeated once a week, providing a comprehensive therapeutic approach to addressing psychological trauma and fostering healing on multiple levels.